everyone. Thank you so much for attending our press conference. We will start with Board of Supervisor Angela Conley. Angela?
Thanks, Nola. Good morning and thank you for being here. We want to provide you today with a few updates regarding Polk County's COVID vaccination availability and our planning. We know that you are anxious to get the vaccine, and we are extremely anxious to get it to you. We are very frustrated because we have had many of the process and procedures in place to vaccinate a large number of people, but we simply, obviously, don't have enough vaccine. Our health department staff is working around the clock to administer the small amount of vaccine that we have, and is often surprised by the alterations of the eligibility recommendations from the state. We were surprised when the recommendation was made to open availability to people 65 plus without an increase in supply, and we weren't ready. And I'm apologizing for this, but make no mistake, in Polk County, we take care of our seniors. We have been working hard this week to make adjustments to our scheduling and outreach to accommodate this population. Taking care of our seniors has always been a top priority for the Board of Supervisors, and we will remain that until every senior who wants vaccinated gets vaccinated. We do have over 61,000 people in Polk County over the age of 65, and we will not have enough vaccine to vaccinate all of them immediately. We are taking steps to make the process of accessing vaccine easier for that population, but please remember, we are still dependent on this supply of the vaccine. Starting Monday, this is where it gets exciting for me. We will have a call center open that will be staffed during regular business hours to take phone calls from the seniors who need help making an appointment for the vaccine. If I heard one thing, it's that they can't navigate the website or they don't have a computer. The number for seniors to use if they need help scheduling is 323-5221. The general public, please continue to use call 211 for answers to the general COVID questions. And this call center is reserved for mainly seniors who need help making their appointment. Nurses will help them sign up online at the Polk County Health Department's drive-through clinic and our partner pharmacy clinics. However, remember that appointments will be extremely limited to the vaccine supply. The number that our seniors will call and talk to the nurse starting Monday is 323-5221. We will also be working with our senior centers and supplemental foods to communicate directly to the nearly 5,000 seniors that we have built relationships with. We're also extremely thankful for ARP by stepping up to help us communicate directly to this group as well. We know that this is very frustrating for everyone, and please continue to be patient. Believe me, if we had enough vaccine, I would personally go out to every house in Polk County to give it out, but we're doing our best with very limited supply with every changing guidance. The state has announced a new phase of eligibility on Monday. With very little increase in supply, we fully anticipated an even larger difficulty in accessing vaccine. For example, in a perfect world, we would have enough vaccine to go to every school district to vaccinate our teachers, but that is simply not a reality. We are begging you to be patient as we continue to navigate this impossible situation. Our community partners are also working as hard as they can be, and we're continuously working for better ways to collaborate and streamline the process in an ever-changing environment. I really want to thank the staff here at Polk County. They have, when I say working around the clock, I mean they have literally been working around the clock. Helen, her team, Nola, AJ, they have all done just unbelievable amount of work trying to get the information out as best we can. So I really can't thank them enough, because this is a trying time for all of us. It is a tough, difficult time. People want to be vaccinated, and we want to get that vaccine in their arms, and we're doing the best that we can with the supply that we have. So at this time, I want to get Helen up here to talk a little bit more about what we're doing. Thank you.
Well, thank you, Angela, and thank you for your kind words. Our staff is working hard, and it takes a whole community to tackle this task. It is the most rewarding work that we have ever done. When you see the relief and gratitude and the tears in our public's eyes when they receive that first dose of vaccine, it moves us to tears. And we are working hard to get vaccine in the arms. We know that many of you are eager to receive vaccine. We know that you have spent time away from your family, friends, and loved ones and want to get back to enjoying normal life. We do see the frustration and concern in your faces. We very much understand how you're feeling. One of our main goals in public health is to have our whole community vaccinated. We are just as frustrated as the community is with the shortage of vaccines. I want to echo Angela's words. We are asking the public to be patient. At this time, the demand for the COVID-19 vaccine far exceeds our supply. Appointments are based upon available vaccine supply. We do not make appointments without having a shot attached to them. This process will take some time, but we will not stop until everyone who wishes to be vaccinated is vaccinated. As vaccine supply increases, we will continue to increase the number of clinics and pharmacies providing vaccinations. The Polk County Health Department and our partners are prepared and ready to provide expanded COVID-19 vaccinations through our primary care physicians and additional pharmacies as that vaccine supply improves. Please visit the Polk County Health Department website for the most up-to-date information and for online scheduling at various locations. Again, what is limiting vaccination capacity today is the supply of vaccine, not the number of vaccine providers. Healthcare clinics will start vaccinating patients based upon state and local public health guidelines. If you are eligible based on your age, your primary care doctor will start notifying you via phone, direct mail, and or through your health system website portal when you are eligible to call and schedule an appointment. Our clinic partners are asking that at this time, please refrain from reaching out to clinics as they will be contacting their eligible patients. Many of the clinics do not yet have vaccine and will be using as many staff people as they can to administer those vaccinations once it is available. Phone calls to the clinic may go unanswered due to the prioritization of vaccine administration. I also want to address second doses. We're getting many questions about those. You may go anywhere vaccine is available to receive your second dose. If you have been vaccinated at the Polk County Health Department, you will be notified the week before your second dose is due, notifying you that you are eligible to sign up for the following week. You will be sent a private link to make that appointment. If you have been vaccinated at a location other than the Polk County Health Department, please contact that location for guidance. All community partners have a plan to accommodate second doses. You can receive the second dose of Pfizer vaccine on or after the 21st day and Moderna vaccine on or after the 28th day. This date should be listed on the back of your immunization card that you receive at that first appointment. The booster dose provides enhanced immunity anytime after the 21st or 28th day, respectively, for Pfizer and Moderna vaccines, and should be given at the earliest opportunity. You do not have to have it on the 21st day or the 28th day. That's the earliest that you can get that dose. Our partners, both Hy-Vee, Medicap, and Drake, also have plans in place to help individuals receive their second dose in a timely manner. I want to address directly vaccine allocation. As Angela said, vaccine supply remains extremely limited, and we have a large population eligible for these doses. The Polk County vaccine allocation for the week of January 25th is 7,075 total doses. This is the vaccine that will be administered during the week of February 1st. The breakdown of those doses is as follows: 4,500 Moderna vaccines for second doses, 1,600 Moderna vaccines for first doses, and 975 Pfizer vaccines for first doses. Angela alluded to this. Who is eligible for these doses? People who are 65 years of age and older, and that is over 61,000 Polk County residents. First responders, PK through 12 staff, early childhood education, child care workers, and then we are still vaccinating the 1A healthcare workers that did not receive their vaccine earlier. That is the group that is eligible to use those 7,000 doses. You can see the math. It doesn't add up. While vaccinations are underway, it is imperative that we continue the prevention practices that we have used throughout the pandemic. These COVID-19 prevention practices keep our community safe until enough people are vaccinated. I'm going to say them again. You probably have them memorized. Polk County residents should wear a mask at all times in all public places and stay at least 6 feet apart. Wearing a mask and keeping your distance protects you and others. Wash your hands frequently, and please stay home when you're sick. Again, we want to thank our community partners from the bottom of our heart. We cannot do this without you. We want to thank our community for your patience and understanding as we work together to vaccinate our community. Thank you.
All right, we will open it up to any questions. If there are any questions.
So there are only going to be 2,500 or 2,600 new slots for people who haven't got vaccinated.
As of 10:12, yes.
And
10:12 a.m., yes.
at noon, or you'll be opening those slots at noon. Are you just going to be doing 1 week of appointments?
We only do 1 week of appointments because we allocate only 1 week of vaccine to ourselves. We are pushing vaccine through in 1 week cycles. Our commitment is to quickly turning vaccine throughout our community and not stockpiling vaccine. And all of our partners are doing the same. We have over 200 vaccination providers waiting to receive vaccine. So there is no need for us to stockpile vaccine in any location. We're working on a 7-day just-in-time throughput for vaccinations.
Why is Iowa so far behind the rest of the country in terms of vaccine supply?
That is not a question that I can answer. That is a question, it is the Iowa Department of Public Health and the governor's office that are in conversations with the CDC. The CDC is the one that determines the allocations to the individual states.
How are you breaking this down between essential workers in tier 1 and then the 65+ population?
We are not separating out eligibility within that tier. People within that tier are all at this time still competing for those same limited doses of vaccine. So there is no prioritization. From the Iowa Department of Public Health, it is 65 years of age and first responders and education and child care workers. So it's an additive.
Helen, are you concerned that people who most need the vaccine are not going to be able to get it right away because there's so many people not eligible?
Tony, there's always a concern that not everybody who needs the vaccine is going to get it when there's a limited supply. And we are working hard to reach those seniors through that call center, making sure that they're not left behind if they don't have the technology. Technology is great, it's efficient, it makes our drive-through really, really efficient. We are committed to making sure that we help people overcome that hurdle of getting in and getting that appointment. We can run people through our department very quickly once we have that appointment in place.
We've heard of some people showing up at the sites without an appointment that meet your criteria and have been able to get vaccines. What would you say about
Every vaccine site manages their vaccine differently. We are making sure that we do not waste a single dose. There are extra doses that come out of the vials that are available often at the end of the day, and the instructions that we've received from the Iowa Department of Public Health are to get those into arms. Do your best to get them into the arms of somebody that's in that priority group, but get them into arms. And once a vial is punctured, you have a 6-hour window to use that vaccine. So sometimes we're not perfect about whose arm it gets into, but it gets into an arm. And that goes back to that original goal of what we want everyone in this community to be vaccinated. And we will err on the side of getting it into an arm of someone that wants that vaccine if that's the only option that we have. We have not wasted a single dose of vaccine here at the Polk County Health Department. Not a single dose.
Sort of jumping off that, with having to schedule people in groups of 10 and such, and cancellations or no-shows, are you gonna have a waiting list?
We do not have a waiting list. What we do is we open those appointments up throughout the day. As the schedule rolls through, we have someone that's managing and looking at our schedule every 10 to 15 minutes. Other sites may have a waiting list. Recently, when we have had extra doses and not been able to do it, we have called the Sheriff's Department to send their deputies in, knowing that they were coming in this next year. So there are multiple ways to manage it.
Do you have any rough estimate of how long it's gonna take to get through this next visit?
It's all dependent on vaccine supply. Right now, at this pace, a long time.
How optimistic are you that there will be other vaccines coming online specifically right for the next month?
Well, I think we got some encouraging news that about Johnson & Johnson today. And again, the more vaccines, vaccine types, and presentations we have that get approved by the FDA and have an emergency use authorization, we welcome those. We welcome having those coming into our community. We monitor those timelines, and we're prepared to use them should they become available. Any other questions? Okay. Thank you. Thank you.